Good evening. I'm Susan Craighead with the League of Women Voters of Naperville. Thank you for joining us this evening. Tonight, we'll be speaking with Naperville's longtime fire chief, Mark Puknaitis. Our fire department provides a wide variety of emergency and educational services to our community, something that becomes clear even with a brief examination of our city website. We're looking forward to our discussion tonight. Please don't hesitate to virtually raise your hand during the presentation with questions or to put them in the chat. Welcome, Chief Puknaitis.
Well, thank you. And I want to thank the League of Women Voters for putting together this little chat or discussion, or I wouldn't really call it a presentation, but it's a great way for me to talk about our wonderful fire department that we have in Naperville, and maybe clarify or answer some questions that any of the group has.
So first, if you would just tell us a little bit about yourself, a little overview and background.
Sure. Well, again, my name is Mark Puknaitis. As the fire chief of Naperville, I started my 16th year in December of last year. And I've been in this line of work since 1985 full-time. I started with a small town out in Maywood, Illinois, and I worked there for about a year before going to Oak Park, the village of Oak Park, where I worked for 23 years, ending up my last 11 years there as a deputy chief. And then when the fire chief's job came available here in Naperville back in 2008, I had been living here since 1990, raised my family, my 3 children, and my wife have lived here since 1990. And I thought, wow, wouldn't it be nice to at least be in the top dozen candidates for the fire chief's job in Naperville? So I applied for it. Next thing you know, I was in the top 50. And then that kind of narrowed down to the top 20. And then 12. So I figured, okay, great, I've achieved my goal, and kept going. And then before we know it, there were final 5 and 3. And then I was chosen to be the new chief back in 2008. And if you remember back in that time, we were going through some pretty hard economic times in 07 and 08. And Naperville went from a very strong locomotive to a screech stop, and weren't sure what the revenue stream was going to be, and we weren't sure which way we needed to go. But we also needed to right-size ourselves because we had been growing for such a long time. So I was tasked with right-sizing the department as well as dealing with the economic conditions that we had. So I've been here for now 15 years as the fire chief. I love it. I love this department. I think we have the greatest department in the world, actually. And we've been internationally accredited now for 6 5-year cycles. So for 30 years, there's only 2 fire departments in the country, actually in the world, because it's an international accreditation, that have been able to achieve that. Us in Greensboro, North Carolina. So very proud of what we've been able to accomplish, but even more proud of what we're going to be doing well into the future. And I'd love to talk a little bit about that later in the discussion.
So how many employees does the fire department in Naperville have right now?
So we're a fully paid fire department. We have 207 members. We have 185 members on shift, which there's 3 shifts, 3 24-hour shifts. And the remainder are fire administration, fire marshal, fire prevention, and training support and emergency medical services support for all of those people that are out on the street.
Do people typically have rotating shifts, or do people like their shift?
Yeah, so the way that it works, unlike the daytime people, I do a 40-hour work week, which actually turns out to be about a 60-hour work week. But the people on shift work 24 on, 48 off. So the folks that came on today started at 7 o'clock this morning. They will work till tomorrow at 7 o'clock. And then another shift will take over and work from 7 till 7 the next day. So they will have 2 days off, and they'll come back to work then on, let's see, today's Wednesday, so they'll come back to work Saturday morning. And then they'll work that throughout the year, regardless of whether it's a holiday or a a day off for most people. We don't have that. So we have to be there 24/7. And it works out very well for some people. Some people, it's difficult to get used to. Some people leaving that and going to a shift type or a 40-hour week is a little bit of a transition as well, as you can imagine. But it has benefits and drawbacks. Certainly your sleep deprivation is limited because, on and off overnight with a department like us, we're doing about close to 50 calls a day. And but we have 10 fire stations over a 55 square mile area. So we're busy, certainly a lot busier than we were many years ago. But we're responding to a lot of different type of calls too than what we used to be responding to.
Yeah, I think when you're a little kid, you think, oh, I'm going to be a fireman and you're going to fight fires. But it's been a long time since that's the only thing that our fire departments did. Can you talk a little more about the
Yeah,
balance between the emergency services?
sure. And I always tell people that we've got the wrong name on the door, because when people say, oh, it's the fire department, I'll have neighbors ask me, how many fires did you have today? I'll come home and I'll say, well, we didn't have any fires today, which is, by the way, a good thing. That's a good day for us. It should be a good day for Naperville. But then you wonder, well, then what does everybody do all day long? What did you respond to if you didn't respond to fires? Less than 1% of our call volume. We responded to over 17,000 calls last year. That was a record number. We've never responded to more than that. The year before it was 16,800. Last year it was 17,000, just shy of 400 calls. But what we respond to is mostly emergency medical calls, as you can imagine. And that's over 70% of our call volume. So less than 1% structure fires, bona fide structure fires, and the remainder, emergency medical calls, vehicle accidents, fire alarm calls, and other miscellaneous types of calls, service calls for people. But the name should be the Naperville Emergency Medical Services Department that occasionally fights fires. And that's the way it is. It's not just in Naperville, but it's across the board. And that's partly due because of the code enforcement that we have, the way the buildings are built these days, and public education. We have a great public education program and campaign, and our little kids that go home and tell their parents the way that they should keep things in their houses and not use candles and do things. Those are our little soldiers around town that help keep the city safe.
So do all the calls come in through 911 or virtually all of them these days?
Yeah, they all ultimately come in through 911. If for some reason somebody calls a non-emergency number, and that'll happen occasionally, we will redirect them to hang up and dial 911, because that way there's a call stamp attached to that and there's a way of tracking it. Ultimately each call does go through the 911 system. And from there, we have a series of times that we track from call handling, which is when the call initially comes in to our telecommunicators, it's very unique. Naperville has its own telecommunications system, our own 911 system. We don't share that with anybody. And we're one of the very few areas that have its own. So from a call handling standpoint, it goes to a dispatch, and the dispatch then contacts the proper station and indicates the nature of the call and who's to go on that call. And then what we have is a turnout time, which is the time that we get that call from dispatch until the time we go out the door. The wheels start rolling and go out the door. That's called turnout time. And then from the time the wheels go out the door to the time that we arrive at your location is travel time. But that doesn't end the call, because what happens is when we arrive at the scene, especially on an emergency medical call, we have to make patient contact. So especially if it's in a high rise or an apartment complex or school, maybe it takes a little while before we can make contact with that person. So we radio in when we make contact, patient contact, and then all that time gets tabulated. And our standard is 6 minutes of total response time, 90% of the time. So from that time that you pick up that phone and talk to that telecommunicator to the time that we make contact with the patient is less than 6 minutes, 6 minutes or less, 90% of the time. We can't do it 100% for a variety of reasons, but that is a very high gold standard that we're very proud of, and we've upheld for a very long time.
So when that 911 call comes in, that person answering that call determines whether it's a police department call or a fire department call. Is that
Yes,
true?
yeah, it does. And the first question that is asked is 911, what is your emergency? So that call will get relayed to either a fire or police dispatcher. And we have people that are, we try to keep 24/7 dedicated fire or police. We have people on a fire console, police console, and they rotate around. But yeah, it goes to that telecommunicator. And as soon as that telecommunicator gets your name, figures out the nature of the call and verifies the telephone number that it's coming from, that call goes to it goes from a call taker to a dispatcher. So now the call taker still stays on the line, is talking to you and asking you a series of questions. The dispatcher has relayed that information and is now dispatching those companies to the call. You don't see that happening. So you're thinking that, well, they need to stop talking to me and get the ambulance going. And we've had people say that, and we're like, you know what? The telecommunicators will say, they're probably about a minute away from your house right now because we had the dispatching done. It's very unique, and most call centers don't have that. We have that. We do that here because we have our own call center, and we can afford to do that. So that helps us with our turnout time, getting vehicles out to the scene, and keeps that 6 minute, 90% of the time, as much as we possibly can.
So are all of this is an audience question, firefighters, paramedics?
Over 90% of our staff is paramedic. Even the officers, myself, I still maintain my paramedic license. And it's one of these things that it's very, it's not easy to obtain. It takes a lot of training. And why give that up? Because when you're going out on a call, you can still help people that are that from an advanced life support standpoint. And we're very proud of that because whether it be emergency childbirth or cardiac situations, respiratory, there's tremendous things that we can do. We have 20 some drugs that we use. We're kind of like an emergency room on wheels. So we pride ourselves on that. And when that ambulance is out, the fire engine, we may be the first vehicle at the scene of an incident, equipped with paramedics and a drug box and cardiac monitors and intubation equipment. So we can do everything that ambulance crew is doing except transport the patient. But by the time it comes to transporting the patient, we have another ambulance that's at the scene.
So how does 911 locate a person using a cell phone with an out of area code?
Yeah, so the technology that's out there has really been enhanced. I can't explain all the technological functions that occur now, but at times, I will tell you, at times you may get a call that goes to the wrong dispatch center. So let's say you are right on the border of Aurora and Naperville. That 911 call may go to Aurora. If that happens, Aurora can switch that over to Naperville in an instant. Or Aurora can take the call, send it over to Naperville to the dispatcher, and then they can relay that information out to the stations. But for the most part, the technology allows us to find the geoproximity of the closest fire station where you're located to, and that kind of determines where that dispatch center is going to go to. Because we look at jurisdictional borders, and what we've learned over the last decade or so, that it's not those borders that make the difference. It's who has the closest unit. So there are areas in Naperville where a Lisle fire station is actually closer than a Naperville fire station. And at times we would send that unit before Naperville. So we have agreements with Warrenville, with Lisle, with Plainfield that we want to make sure that the unit gets there as quickly as possible. That doesn't mean we're not going to send a Naperville unit, but we have these automatic and mutual aid agreements with towns all around us. And we're very fortunate to have that because there are many places around the state that only have their own fire department. And if they're out, they're out. You just have to wait.
So even if I have a New Jersey area code on my cell phone and I've been living here for 5 years and I call, you'll find me.
Yeah, if you dial 911, yeah, it's gonna that phone is going to be tied to a cell tower, and that cell tower is going to determine which is the closest fire station to send you to. It's not a perfect system. There are times that, like I say, that cell tower may be closer to Aurora, but in big cities like this, I'd say nine out of 10 times or more than that, it's going to go to the right cell tower that dictates what dispatch center you're going to see.
So I'm sure that's all very comforting to us who have moved from out of town. It's a little scary how much everybody knows about where we are, but yeah. I think we're gonna go with that. Someone wants to know where the call center is located.
Yeah, so what we call that is our PSAP, our Public Safety Answering Point. And if you know where Safety Town is, off of Aurora Avenue and River Road right there, the police department is located right in that area, right across the street from Safety Town. In the police department is where our 911 center is. So we use that as our 911 center. We have a backup 911 center in case something goes wrong or in case that center needs to be evacuated, which is Aurora. We'll use Aurora for that. And we have very similar radio systems and networks that allow us to interchange. We're also the backup for Aurora. And if those two fail, we can actually go to our emergency operations center, which is at the fire station headquarters, which is right across the street from the police station in our public safety campus. And we have probably the safest place in Naperville in our emergency operations center because it's concrete fortified, designed to withstand earthquakes and tornadoes. And if we have large disasters, we will meet with the city staff and directors and we'll go down there and create emergency plans. For instance, when the tornado happened a couple years ago, we used that for that. But yeah, we were fortunate to have our own call center, and we call it a PSAP.
So to move on a little bit, I know that there has been interested in the Community Advocate Response Team, CART. There's been some news about that, and we've had some questions about that. I wonder if you could tell us about it.
I would love to. And it is probably one of the most one of the programs that I am truly the most proud of that we're evolving into since I've been doing this nearly 40 years. What CART is, Community Advocate Response Team, is in response to some research that we did. I'll go back to a call that we had, a person within the town a couple years ago that would call us nearly 1,000 times a year. Same person calling us about 1,000 times a year. And we would go out and sometimes we would take that person to the hospital. Most of the time we would. Sometimes we would be at the scene assisting the person. And we said, we can't do this anymore. We have to find a different way of doing that. But we don't normally have the luxury of staying with somebody more than 10 minutes or so before we have to make a determination. Do you want to go to the hospital or do you want to sign a release? One way or another, because we have to go back in service. We have other people that we have to serve in the community. So we decided with this person, we're going to spend time with the individual and do whatever it takes to solve this problem. And it took time to do that. But long story short, we solved the problem for the individual, taking the time. That person still lives in the community, still lives in the same place, still has the same problems, calls us about 2 or 3 times a year now. So we decided this program works in a lot of other cases. There's people all around the community that have issues. I will argue that everybody in the community has an issue, whether it's mental health, relational, financial, there's something that is going on with people. And Most of the time, when somebody calls 911, if it's not for a medical emergency, it's for something else. And sometimes we have a senior that will call us because their relatives live 2,000 miles away, and they call them and they're saying, you know what, we can't help you, mom or dad, just dial 911. So they call 911. We end up taking them to the hospital. They get evaluated to no avail, and they end up back at the house. And now they've had a ambulance call charge. There was an emergency room charge, and now they're back at square one. So what this CART program does is it's an ambulance. It has to be an ambulance because in case it turns out to be a medical emergency, we have to have paramedics on the scene. So when we get on the scene of these non-emergent type of calls, we will find out what is going on with the person and what can we do to help. So we started this as a pilot program on a 40-hour-a-week basis in 2023. And for the entire year, we looked at that and we monitored the activities and we gathered resources and we found out that we could help people. But the issue is there's people that need help beyond 5 o'clock in the evening and on a Saturday, on a Sunday, and on a holiday. So we were able to work with the state and receive a modifier code that allows us to get actually reimbursed for these services that we now offer on a 24/7 basis. So from a city's cost standpoint, it's not costing, the city is not paying additional revenue. We're getting the calls paid for, but what we're saving is Medicare, Medicaid, and the insurance companies a tremendous amount of money because they don't get transported to the hospital when they don't need to. And we're figuring out the problems for these folks. And I can't tell you how many people have called and said, thank you for spending the time to help us to figure it out. Because every single day now, we're developing a resource bank that gives us the opportunity to find out if it's psychological. We get other people that'll help out. We're not saying that we're the counselors of all and everything, but we're going to figure out what resources our residents need to solve their problem. Sometimes it's a medication change. Sometimes it's getting a hold of the right doctor to give them the guidance that is what they need. I can go in, there's a variety of things that we're dealing with, and our people are specifically trained for this, and they get more and more training every single month that we're doing this. So they're becoming experts kind of at this non-emergent type of care. But it's so important because I did an analysis about 5 years ago, and all of the calls that come in through 911, out of all of those calls, less than 30% turned out to be actual medical emergencies, something that truly requires that 6-minute, 90% call time. Most of the calls, if you got there in 10 minutes versus 6, it wouldn't make that much of a difference because they're not having difficulty breathing. They're not in cardiac arrest. They're not in a traumatic state. A lot of people that we go to are in these non-emergent type of situations, but they need more help than just being taken to the local comprehensive emergency unit and dealt with that way. So we're learning about this and we're dealing with this more and more. And since we started doing this 24/7 January 1st, and I anticipate that this will probably bring our department another 2,000 to 5,000 calls a year. We do about 17,000 calls a year right now, which is a record. Last year, we did over 17,000 calls. It's more calls than we've ever seen in the 150 years that we've been doing the service for the city. So this is a program that is going to be so helpful for so many people. There are people out there, whether it's autism or memory challenges that are out there, the seniors, the elderly, the addiction population that we have, the psychological issues, the pre-suicidal situations that we have. I will tell you this, when we respond to a call, we're very good about response, like I told you. But that means something has broken. Either somebody's furnace malfunctioned, their fireplace malfunctioned, something went wrong where they used a candle the wrong way, or their heart malfunctioned. We go on things and we respond to those. What we're trying to do with CART is we're trying to be progressive in the fact that we can maybe eliminate some of these things before they happen, so that we don't have to respond to as many of these calls when we open up the garage door. And I'm just going to say this is going to be a little bit shocking, but find somebody hanging from the rafters, and that happens. Or we find somebody in bed that they took an overdose of pills an hour before we were able to even come close to saving their life. There are these calls that are out there. There are these situations that are out there every single day in this city. And if we can get in front of those, it's part of our community risk reduction program, just like we do with fire prevention. We've eliminated a lot of fires because we were able to get in front of those with fire prevention. We need to do that with mental health prevention, and react to people, let people know that there is help. Sometimes people they resort to finding an exit in life because they don't think that there's any help, that there's no help out there. We want people to understand there is help, and all you have to do is dial 911, and we will be out there with these non-emergent services. So the CART program is huge, and it's something that nobody else in the state right now is doing, and very few agencies around the country are doing this now, because traditionally we have always been involved with emergency services on a medical emergency basis and a fire emergency. This is a new paradigm in the fire service, and it's something that is going to make a huge difference in the city of Naperville.
So do you have different teams of people who would be on the CART, or is it additional training for the paramedics, or how does that work?
So we have, in our CART program, we have 9 people that are involved with that. It's kind of like a special team. So we have water rescue, we have hazardous materials, we have technical rescue teams. We also have a CART team, and that CART team is made up of very specifically trained people that are focused on what we're talking about. And we're continuing our training with that group of people. And they're firefighter paramedics. They're people within the department that have chosen to pretty much prioritize their careers at this point in time on these types of calls. They also get rotated on a fire engine and a fire truck. So they're not like pigeonholed into this type of call status. But it takes a special person to kind of deal with the psychiatric calls and the mental health. And we don't mandate that anybody does it. We look for volunteers to do that. And we had about 13 people that volunteered for this. So we had to select 9 out of those 13 to go into this program. And going forward, from what I understand, there's about 5 other people that want to get into this, but we just don't have room for them right now. So these are a 1-year commitment, and we're hoping to cycle other people through that as time goes on. And like I say, it's just different than what we've done before. But anybody that has done this and has dealt with these types of issues with people feels a value professionally that they don't get as much from the traditional firefighting and even the regular medical responses. So, like I said, there's people that have a lot of issues out there. We're learning to admit that in Naperville, and we're learning to respond accordingly to that and appropriately with the trained people. We have access to a tremendous amount of counselors. Our police department has counselors that we have access to, and we have a resource bank of people in the community that we can call to the scene. And we're learning more and more how to deal with these resources that we have on literally a daily basis.
So would you consider this program fully operational at this point?
Yep, it totally is. It has been fully operational as of January 1st. And, from a 24/7 basis, it's not one of these things where you're going to find us saying, well, we didn't have the staffing today, so we're not going to be able to put CART in service. We haven't publicized it yet. We are planning by the end of February to have a media event that is going to, we're going to talk about this on the social media. We're going to talk about this on the local networks, and we're going to get the message out initially that this program is available through 911 for the entire community. And then what we're going to be doing is we're going to be sending this message out regularly so that people have an understanding. There's a 988 system that was the old suicide hotline. If you dial 988, it's going to get you to 911 anyway. So we want people to understand and not be afraid of dialing 911. You're also going to see an ambulance that looks different. It's going to be a lights and siren ambulance because we have to, by law, respond to that in case that call turns into a medical emergency. But that ambulance is going to be wrapped differently. It's going to have a more subdued look to it, and it's going to say Community Advocate Response Team. And we want to make people aware that this is available. And part of it is when they see this ambulance out on the street, oh, wow, what is that? That looks different than the regular ambulance. Media coverage on a regular basis is going to help too. But the biggest thing, we just want people to understand that there's a mechanism for help out there. And you don't have to worry about, how to call, who to call, when to call, or if there's going to be availability. Dial 911, we will be there. And I think we will make a big difference.
And is this a situation where there is somebody on the cart, and it's CART, on the team at every fire station?
No.
Or how does that?
Yeah, I wish if I had a genie that asked me what would I possibly want, I would say something like that. But there's only one ambulance right now that is a CART ambulance. If for some reason we get 2 calls in a row, we have to send a traditional ambulance out. And it's not going to be the exact same type of service, but we're still going to have somebody out there responding. So what we're going to be doing over every quarter of the year, we're going to be looking at the data and the metrics associated with this CART program. And if the program escalates to the way I think it will, we will expand it accordingly. And that will mean putting another ambulance in with more people that are specifically trained for this and just duplicating that. And we'll do that as much as we have to maintain the call demand that's out there, just like we would in any other type of situation or any other type of special team that we have. So the good news about that is as the call volume increases, so does the revenue stream that is associated with this. So it will continue to pay for itself and then some, but I don't like to advertise it that way. I mean, I've had to discuss this with our city council because, of course, the cost factor always comes up. But I don't like to say that we do anything because it's a revenue generator. In this case, it causes us to stay at least cost neutral and possibly even generate more revenue. But the biggest thing is it's able to sustain this into perpetuity. So if the call volumes increase by 10,000, I theoretically have a mechanism how to make this work. Now, eventually, that could mean other resources that we need. I don't know how far it's going to go, but I will tell you, if the call volume does get even higher than I think it will, that tells me that there truly was a need in the community for this, because people aren't just going to call for the heck of it. They're going to call because they're in need. And I think there is a need out there, and we're going to be looking at that. And I'll be reporting that on a quarterly basis to the city council on a regularly televised council meeting. So people will be able to see this data. It's public data, and the calls for service are what they are, So, I wish that wasn't the case. I wish we could say we don't have an issue like that, but we do, and every community does, because this world is filled with people that have issues. And the better we get in front of them, the less that issue is going to turn into a true medical emergency.
How does a situation that CART respond to differ from something that a police department crisis intervention team might respond to?
Yeah. So the way that we were able to get CART funded was because we were able to send out paramedics that could render emergency care in a way that allows for that reimbursement. The police department has resource officers and counselors that are able to respond to the scene of that. But if those calls turn into an emergency that requires a transport, or that requires any other treatment on the scene, they can't do that because they don't have the medications, they don't have the techniques that we use to deal with that. So we work with the police department very closely. They are a great partner to us, and we're a great partner to them when it comes to bringing in expert counselors to help us out with these things. And there are times that they get the call initially, and they in turn now will call us and our CART team out so that we respond appropriately with them. But the police department operates a little bit differently than we do because originally they are going to get that call initiated in a different way. They may be responding to a domestic and find out that there is a CART type of issue there, and then they would call us. We would get the call directly from the patient, and that's kind of how it differentiates between police and fire. But they have resources, but what the police department doesn't have is that ambulance and that medical training. That is what the state and the federal government wants in order to provide for this reimbursement.
So you touched briefly on some of the reasons that the CART response would be appropriate. We have a question talking about things like drug overdoses. Is there a trend in Naperville and other communities that we might like to be aware of?
Well, yeah, drug overdose is a big problem, and it's not necessarily youth drug overdoses. We get drug overdoses in all ranges, in all age ranges. And is it escalating? Yeah, I would say if you had to trend it, yes, it is. But our community is also growing, and we're responding to more calls. There's more people in town. And I guess I would also say that there's more accessibility to certain drugs and the drugs are a lot more lethal than they were in the past. So the fentanyl situations and the other types of very potent drugs are easily accessible out there, even in the high schools, especially in the high schools. We notice this. This is a problem that is going to take a long time to resolve because you need to start with the elementary schools and the middle schools and getting this message out, which is what we're trying to do right now. I'm not saying that we're not doing anything with the high schoolers or even the other age groups, but we need to start at the core of this before it starts. And that's why we're starting at a very early age to educate young people and let them know that, this isn't the right way to go. In the society that we live in, it's so easy to get involved with these drugs that we have to kind of change that and figure out how to do that. And it's not an easy task because there's a lot of pressure. There's a lot of temptation out there. In this area of the state, there's a lot of money out there that changes hands as well, and accessibility, and the drug dealers know that. The police department does a really good job on trying to track down where these places are located and try to get the core of the problem. But this is a long-term effort that we need to realize. It's not something that we're going to fix in 3 or 6 months or even 3 and 6 years. This is a decade-old problem that we're going to have to work on in order to be successful.
So clearly, our firefighters have a lot that they deal with. They're faced with people who have mental health issues, drug issues, physical issues. Are there mental health provisions available to our firefighters to help them deal with some of these traumatic situations?
And that's a great question because, we're dealing with all this. We're kind of trained to understand that we didn't cause the problem. We're there to help. And if we can't figuring out for ourselves up here in our minds, and what good are we going to do to the people that we treat? But that doesn't mean that we're not human. So when we have to deal with dozens or over career hundreds of calls that we've seen with these suicides, these drug overdoses and things like that, it has an effect. We have a program now, we've had it for several years now, where if somebody is experiencing an issue after a call, we're encouraging people to talk about it. Talk about it, bring it up, and tell us if you have an issue. We've sent people home for the rest of the day because they've just been on a traumatic call, and maybe a call involving a young person similar to somebody that they may have at home, a relative. We allow them the ability to kind of de-escalate by taking the time off. We encourage them to talk about it. And we also have a mechanism in-house that allows us to intervene if they so choose with their peers. It's a peer support group. And the research has shown that public safety personnel would prefer to talk about these things with their peers rather than to somebody that they don't know, like a psychologist or a psychiatrist. There are certainly times when that is all warranted, but for the most part, they want to talk about this among their peers. How you talk about that and how you bring that up and the advice that you give is the training that we're giving the rest of our firefighters right now, because you never know when you're going to be met with that firefighter that says, I need to talk about this. We want all of our people to understand, at least to some degree, what the mechanism is on dealing with these things. And we've had that come up because it affects people differently, and you really don't know how that's going to affect you until it happens. You may say, it won't affect me at all. But when you have to come across a situation where somebody just got struck by a train, and maybe it was a suicidal type of thing, and you have to deal with that patient may be still alive, it plays tricks on you mentally, and that stays with you. You have to have a way of dealing with that and also understand that this is your career, this is your job. And in order for you to be effective, you have to be able to overcome that.
So you mentioned some of the educational things that you do in the schools. And I certainly see from the website, there's all kinds of community involvement programs. I wonder if you could talk a little bit about some of those that you're proud of.
Sure. Well, like I said before, we start at an early age in the schools to do fire prevention. And we work our way through, the junior highs, the elementary schools, the preschools, Safety Town. We're very much involved with that. Then we get into the high schools and we try to get into the career programs, and we try to mentor people that are looking at getting into the fire service, or talking about a little bit why we do what we do, and getting the message across that if you see something out there with your schoolmates and something that doesn't seem right, get involved, but get us involved as well. And, Mayor Worley, on his first day as mayor, created a mental health committee. I'm one of the people that sits on that. And we're developing a program now that we have already had one program, and we're going to continue to do this to get this out, to let the general community know that there are educational programs that we have for all ages that help you to understand how to deal with these situations when they come across. And even more so when you see a peer or a friend or a relative going through this, how you should approach them and not just ignore it. Those are real issues that we have, but we try to get involved with programs like that. We also get involved with programs with the seniors. We do a lot of things with the Seniors Coalition. And we also work with the autism community and 360 Youth Services, Turning Point, Kids Matter program. There are so many different groups in this community that all have specific and very acute needs that we want to try to help everybody. But the only way that we can really help somebody is for them to recognize that they need help and access that 911 system.
Do you have volunteers that work with the fire department?
We do. We have, I'm very proud to say that we have about 70 volunteers in our Naperville Emergency Management Agency, NEMA, as well as our CERT teams that are out there. And these folks are awesome. They take time out of their own lives to be trained to help us when it comes to an emergency. It doesn't matter if it's 2 o'clock in the morning on on a cold wintry night, we can call them and they'll bring out a light truck for us to light up the scene at night. They will help with traffic control. They will help us with a variety of things, resources that we need, rehab vehicles that we have that we bring out to the scene. They are great. Emergency, we just took delivery of a brand new emergency communications center, and they are trained to set that up, not only for the fire department, but for any department. Let's say we have a snowstorm and Public Works is involved, or a police event. They will come out and bring that unit out, set it up, and they really are very knowledgeable. We also have a weather unit. So we have people that are meteorologists and people that are retired from the weather service or currently active in there, and they monitor our weather for us. And when we have a weather-related type of incident, they're monitoring those screens and they're looking for ways that they can alert us so we can alert the community and our own firefighters and firefighter paramedics as to the dangers that are out there with weather. They were extremely helpful when the tornado happened. We get some crazy weather situations in the Chicagoland area. And I can't say enough about our volunteers. They do a great job. We try to recognize them annually. We do recognize them annually. And but they do this because they have a love for helping the community. And a lot of them have a certain type of expertise that makes them a perfect fit for what we need them for out in the street for emergency situations.
What kind of training do they get to be on one of these teams?
Yeah, so it's training that they receive from their own groups. It's kind of like train the trainer type of thing. So in our Naperville Emergency Management Agency, if somebody wants to join that, they will start at a kind of like a lower level, and then they will kind of gravitate up. If they have an experience in weather, of course, we're going to get them into the weather unit. If not, we'll train them on how to drive the vehicles, on how to manage the vehicles. We have an air truck that goes out to the scene that provides air for our air bottles, our air tanks that we use for our self-contained breathing apparatus. So they learn how to operate those types of vehicles. They learn how to operate the equipment and how to set those pieces of equipment up. And once they're adequately trained to do that, then they could kind of move up to be a driver and more of an advanced level type of volunteer. And it really depends on how much time they're willing to spend on learning some of these pieces of equipment. I would say they're all very motivated, otherwise they wouldn't be volunteering for this. And we're fortunate because we've never really had to solicit for these volunteers. It's kind of like a word of mouth type of thing. And over the years, we've maintained a very, very educated and dedicated staff of our core of volunteers that we have. Some of which have been serving as volunteers in Naperville for decades.
It's pretty amazing. Are there resources that the fire department does not have that you wish we had?
Mm-hmm. Sure, I'd love to have a helicopter. You know what? We're fortunate in this town. We probably are one of the very few departments out of even the metro departments that have. So we have water rescue, we have hazardous materials, we have technical rescue, we have tactical EMS. When the Pratt shooting happened in Aurora, we were the first team to go out there and make a rescue of police personnel that were in danger and civilians that were in danger in that incident, because we had, prior to that incident, years before that, training in tactical EMS, where a paramedic goes in with gear, no gun, but with the gear, and goes in with the police to get these people out and actually treating them right at the scene instead of bringing them to a green zone, a safe zone, treating them right there until they're stable and then bringing them out. So we have teams in place. We have a drone team. We have virtually every single resource that you can imagine that will allow us to respond to an all hazards type of approach of incident management. A lot of times I get approached by our city council And their question to me is not, why are you spending what you're spending? But the question to me is just what you asked. What other resources do you need? And I'm glad to be able to be in a position to say that if we need something, we put it in our budget and we allocate resources and we justify the need for them. And if we don't need it, then we don't ask for them. But I look at it from being prepared to respond to virtually any major incident that's out there. If it's somebody being trapped in a cement silo container, which we've had, we're able to rescue an individual like that, or somebody that's trapped in a piece of machinery that has their arm caught in there. Like I said, we can't call for anybody else. We're it. We have to do it. We can't just walk away. Or dealing with the traditional cardiac arrests, respiratory cases, asthmatics, diabetics, traumas, vehicle accidents. It goes on and on. We don't have a schedule when our guys come in the morning at 7 o'clock to say, well, at 2 o'clock this afternoon, we're going to have a structure fire. And at 5 o'clock, we're going to have the diabetic and we're going to have a seizure patient at 7:30. We don't know what's going to take place and when or where. We just know that we have to be ready and reactive and be able to not only be reactive, but be proactive as well, so we can eliminate some of these things even before they happen. So we're very well prepared to do what we do. We have a city that is made up of residents that really have a great deal of respect for what we do. We have a CAPS, Citizens Appreciate Public Safety, team made up of, or group made up of citizens in the community that provide recognition for our members on a semi-annual basis. And the support that we have here politically, from a residential basis, from a partnership agency with all the partners that we have in our community, are really second to none that I know of. So I consider ourselves very fortunate.
So before the program started, you and I were chatting a little bit, and you talked about the geography and the challenges of the geography of Naperville. Yeah. Do you feel like all of our stations are in the right locations and optimized to maintain those good response times and everything that you?
Yeah, so it's interesting. So, 35 years ago, when we had one station, and then we put a second station in, the second station was decided by population pretty much. We had subdivisions that were being built, and we had to make a best guess based on the data that's out there and geography where that station was best placed. Fast forward 35, close to 40 years later, we have 10 fire stations. And we never knew way back where all those fire stations would have ended up. Is it a perfect system? No. If I had my choice, would I change them a little bit? Absolutely, but not much. Where if you look at our grid for station coverage and where it is, we've done a really good job over the years of placing stations in a geographical pattern that serves that 6 minutes, 90% of the time that we have. Some stations are going to be slower than others, I will tell you that. But you're never going to get it perfect because you never know where the community is going to end up. And we don't have the luxury of just waiting and then putting all the 10 stations. We may end up at one point having an 11th station. I think that's going to depend on what happens with CART, the CART program. But from a structure fire standpoint, the 10 stations are very adequate. When we put our 10th fire station in, it was in 2010. That was our last fire station that we built. We put that station in, we didn't hire any additional people. What I did is I reorganized the department and I reallocated people to kind of meet the needs that we had. Saved our city nearly $20 million over the course of 10 years, which is tremendous. And that's just on personnel alone. We were able to continue to meet that. But back then, 10 years ago, we were probably seeing about 13,000 calls. Now we're seeing 17,000 calls. We keep looking at that threshold, and it keeps growing because we're seeing a lot more seniors, residents being built, being being utilized. People are living longer. I will tell you that a lot of people that thought they were going to retire from Naperville, some of those folks have come back because their families decided that they don't get a chance to see them as much because they either can't get the time off or it's too costly. So they're coming back to Naperville. So we're seeing people come back, and people are living longer, which is great. And we're seeing that in call volume as well. And there's just a lot more people in the community. So, and we're responding to different types of calls. So going forward, where are we going to put another station if we have to? I'm not quite sure yet, but right now it seems to be working for us, and it seems to be working well. And I think the people that designs were to go over these last 3 to 4 decades did a pretty good job on matching the geography with the call volume.
Excuse me. What is recruitment like for firefighters? Is it a challenge to recruit people? Do you have waiting lists? What is that like?
So recruitment used to be never a problem. When I started in the fire service, there were nearly 800 people that tested when I tested, and there may have been 2 positions open. Today in Naperville, we will have roughly 10 to 20 positions open on an annual basis because of retirements. And we just did an eligibility recruitment. We had a little over 200 people that came and took applications, which is great for us, but we're Naperville. A lot of people want to work for Naperville. In the fire service in general and in public safety across the board, we're seeing a huge decrease in interest in public safety, especially on the police side. There are many of our neighboring cities and villages that will see a dozen or 24 people only come and pull an application. And out of those, some of them are not going to pass the background investigation, and they may not pass all the other tests associated with eligibility. In Naperville, we're fortunate right now. Like I said, we used to have though about 800 people come and take our application. Now 200. We're happy with that number because when you compare it to other places, we're doing well. Unfortunately, there's other departments that are losing people to places like Naperville and Aurora and Joliet and Elgin because they're bigger communities. There's more chances of advancement. There are more teams to be on, and they're more progressive. I don't know where that's going to lead to in the future, but it is somewhat of a crisis that we're seeing across the region and across the country. It's not just here. And it's society and it's the new generation that wants to be independent, that wants to work remotely, that wants to have the freedom to do what they want on their rules and on their time. And in the fire service, which is a paramilitary organization, we have a rule book. We have a lot of hoops that you have to go through on a daily basis. And you can't just go and work wherever you want. You have to come to work 24 hours a day. That means you're away from your family a third of your life, because 1/3, 24 hours a day, and then 24 hours on, 48 hours off. You're here. And you're not only here, but you're forced to do a job that entails some very testing situations, mentally and physically, and sometimes both. So you have to be a special person. I don't even call it a job anymore. I don't even call it an occupation. It's more of a calling, and it's more of a lifetime quest of serving the public in a very unique way. When we go out into the public, if you think about it, people open their doors to us. They never met us before, but they allow us to do some things medically. They don't know what our qualifications are. They trust us to do things to them on a medical basis that they feel confident that it's going to help them. And that's one of the reasons why we get some of the highest survey result appraisals from our residents. And we do a good job. We have outcomes that are very positive for people. I respect the police department tremendously, but I will tell you from a police perspective, it is difficult because they're normally responding to negative situations. And we're responding to negative situations, but it's a different type of thing because people are calling us because they expect us to help them in a medical way and put their fire out and things like that. A lot of times the police are handling these conflicts, and it's difficult because we're seeing a lot less people apply for these police positions. We're seeing it in the fire department too, but not quite as much here in Naperville as we see in the surrounding communities.
So as we approach the end of the hour, I have one last question. And what are your priorities for the department in 2024?
Sure. Well, number one, and it's always going to be this, I don't want to go to a funeral, if you know what that means. I don't want a line of duty death. So our biggest priority is, and from a firefighting standpoint, from an emergency medical standpoint, from a psychological standpoint, is taking care of our personnel, because if we're not there to do the job, then that's a problem for our citizens. So to make sure that I take good care of my people, that I recognize them when they need recognizing, I provide assistance to them when they need the assistance, and I provide the education and training to make them the best people that they can to serve the community. So that's my number one priority. Second priority is to make sure that I have the resources and the equipment and the apparatus to do the job effectively for the people that we serve. Because one thing is to respond. The second thing, when we get there, we have to do something. So I want to make sure that we have the right resources. The third thing is I want to make sure that we have the funding sources to do what we have to do. And I don't want to hire somebody only to tell them 2 years later that I need to terminate them because of a budgetary issue. If I can achieve all those three things, I'm a happy fire chief. If there's one of those things that I can't do, I'm disappointed. We've been fortunate in Naperville. I have not had have a line of duty death in my duration as fire chief here. I have never had to terminate somebody because of a budgetary situation. The fire department, by the way, is the only department in the city of Naperville that can say that. And at least over the 15 years that I've been here, that I'll take responsibility of. And the other thing is, I will say that we have always been able to say that we have the resources to do the job for people. We've never had to turn away and say, sorry, we can't do this. We need to call somebody else to provide those resources for you. So I'm proud of that. And I'm proud of being in a community that supports that and continues to support public safety. It's more than economic development in this community. It's more than any other priority. It's public safety first. And I think that is reassuring to this community that if they have a situation, and it doesn't have to be the traditional fire or EMS, it could be those psychological situations, we are going to respond. We are going to proactively do what we can to minimize the situations that are out there and continue to save lives in doing so.
Thank you very much. This has been very informative to me personally, and I hope to all of our audience. I also recommend that people take a look at the fire department section on the city website. It also has a lot of good information, a lot of transparency. So that's kind of, a fun extra resource.
One more thing, if I could just interrupt before I forget.
Please.
We also have a Pulse Point app. It's called
I
Pulse
almost
Point.
mentioned that. It's really kind of fun. Tell us about that.
Yeah, so if everybody has one of these cell phones, and all you have to do is go into the App Store and put in Pulse Point, like taking a pulse and pointing at somebody. And it's a free app. The city subscribes to this app that's out there, and it will tell you the calls that we go out on, the vehicles that go out on those calls, the time that those calls go out. It won't give you the exact address, but it will tell you the street. The only thing that we won't put out there is a psychological call or a mental health call, because we want to keep that confidential. But if you see fire engines coming past you in your community, we're not going to say to use this while you're driving, but if you hear that, if you're at home, if you see a fire engine driving by, you may be interested where they're going, you can go on the Pulse Point app and you could see, oh yeah, they're going to this address for a smoke investigation or a carbon monoxide call or a vehicle accident. So it'll give you an idea of how many calls that we go out on. You can track those, you can see where they are. Also tells you where all of our automatic external defibrillators are in the city, and they'll give you CPR and AED instructions if you need them, amongst all kinds of other things. Take a look at the app. It's free of charge for you, and it will follow you wherever you are. So if you're out in California and you want to continue to track Naperville, you'll be able to see what's going on in your community wherever you are.
If you want a little more information, that is also on the website. So thank you for mentioning it. I thought that was kind of, I don't know, fun or interesting. I'm not sure what to say.
Yeah.
Anyway, once again, thank you very much for a very informative evening. If you enjoyed this event and appreciate the community and civic work of the League of Women Voters of Naperville, I hope you'll consider joining us. Just go to the join page of our website. We hold ideas forums most Wednesdays of the month. However, in February, the second Wednesday of the month happens to be Valentine's Day. So we will be taking the month off. Once again, thank you very much for everybody who joined us. Have a good evening.
Thank you, everybody. Happy New Year.
Happy New Year.